Since 2006, AIHA's partnership linking the Tanzania Institute of Social Work, ISW, with Jane Addams College of Social Work and the Midwest AIDS Training and Education Center, MATEC, at the University of Illinois in Chicago, has been working in close collaboration with the Tanzania's Ministry of Health and Social Welfare to strengthen the country's social work profession. A particular focus has been on training a new community-level social service cadre called parasocial workers, PSWs. Through this program, PSWs learn key social work, case management, psychosocial support, and child development skills, so they are better able to address the needs of most vulnerable populations, including orphans living with or affected by HIV/AIDS. The comprehensive multi-stage training program arms PSWs with knowledge and skills they need to identify children and households most at risk for HIV infection and then provide necessary care or referrals to other organizations for needed services. The case management approach PSWs employ helps ensure vulnerable children and their caregivers have access to a holistic support continuum that includes health and allied care, education, nutrition, legal and other needed services. In collaboration with the Tanzania Human Resource Capacity Project, AIHA and our partners have fully trained 2,563 certified PSWs, 743 PSW supervisors, and 103 master trainers. In addition, another 2,119 individuals have completed PSW training. ISW leads all related technical assistance and quality control efforts for implementation of the PSW training.
And tell me about the Institute. What does it do?
The Institute teaches in the field particularly of social work, and it also has other fields like the human resource management and industrial relations, and it is the first school in Tanzania to start training social work. It was established in the year 1973 to train social workers, and it has been expanding its training programs. It started with ordinary diploma, then we had the advanced diploma, and now we are offering courses at the level of bachelor's degree up to master's degree.
Wow. Why is orphans and vulnerable children such an important issue here in Tanzania?
It is an important issue because the number of orphans and vulnerable children raised due to HIV/AIDS and the pandemic, and also it was due to the change of the economical change of the country itself. That's made the increase of orphans and vulnerable children in Tanzania, and this has been noted in various areas, especially in urban cities.
And what's the role of social work vis-a-vis orphans and vulnerable children? Why is social work important?
Social work is one of the professions which help individuals, groups, and community. And vulnerable children is part of the groups and community of which the social workers serve. And the profession itself is enabling the community in order to identify various problems which orphans and vulnerable children face in our community.
I see. And tell me, why is it important to include this topic here at the Institute of Social Work when you're developing curricula, as I understand you do, when you're teaching faculty, when you're developing the social work cadre, and when you are developing associations and policies and recommendations?
This is one of the special group which the government needed us to consider, and we took orphans and vulnerable children mainstreamed it into our curriculum so that our students will be in a position to be able to identify, help those caregivers and community volunteers be able to identify various issues that face the orphans and vulnerable children in our communities.
How has the University of Illinois and their social work program helped you?
The University of Illinois, specifically our partners, MATEC, have helped us on the side of technical issues, especially in developing the curriculums for which we are using in training parasocial workers who are paraprofessionals who are working at the community level.
And Sally, I know that you and your university provides technical assistance and helps out in the Institute of Social Work. But I'm sure you also have learned a lot coming here, as you have for many years, to Tanzania working. What do you bring back to the United States in some of the learnings and best practices that you've learned here in Tanzania?
I like to, when I'm in the classroom, teaching in the classroom, especially when I've just been here, when I come back, incorporate into the material some of the things that we have been developing here. And I think it helps the students start to think more globally and internationally about how they can be effective, and it gives them perspective outside of just what's happening in Chicago or Illinois or wherever they might end up practicing. So I think it enriches the students' experience that we go back and teach.
Have you been pleased with the support that the American International Health Alliance has provided? And what are your hopes going forward in terms of how we can continue to collaborate and support the efforts that you undertake?
Great, a lot. The partnership has been very helpful to our Institute of Social Work, especially in strengthening the capacity of our staff, the social work staff. And also we see it moving forward in terms of expanding the program, since the Institute itself is expanding the horizon to other regions. So we see this partnership growing, and in one way or another we'll be collaborating in when we are expanding our program, especially the OBC program, together with the social welfare assistant and parasocial training in Tanzania.